Hello, my name is Yesenia Reyes, and I'll be conducting a head, ears, eyes, nose, and throat assessment on my volunteer patient. So I've already performed hand hygiene and introduced myself. So first we'll start with the general symmetry of the head, looking at the general shape, symmetry. While I'm doing this, I'm also checking skin color, making sure it's appropriate for ethnicity, checking the back of the neck here for any discoloration. Everything looks normal. Next, I'm going to move on to the hair, checking for distribution, color. Everything looks fine, normal, no patches. I'm also going to go ahead and check the scalp at this time for any indentations, masses, lumps. Okay. And while I'm here, I'm also going to be checking for the thyroid, which is right here, as well as the trachea, making sure it's midline. Okay, go ahead and swallow. Okay, so with the swallow, I did feel the elevation of the thyroid. I'm also going to be feeling for the lymph nodes. So here's the submental, submandibular, tonsillar, preauricular, postauricular. Then I'm also going to be feeling here for the anterior cervical and the posterior cervical lymph nodes. Everything's normal. Also feeling for the supraclavicular lymph nodes, which are also normal. I'm also going to be listening to the trachea for any stridor. Okay. No abnormal sounds heard in the trachea. Next, we're going to move on to the eye portion of the exam, where we're going to use our Snellen chart. This one says to hold 6 feet from the patient. So I'm going to go ahead and have you cover your left eye and read the lowest line.
EPTZO.
Okay, now cover your other eye.
EPTZO.
Okay, and now both eyes.
LTF. TH.
Okay, so for this exam, for each eye individually, it was 20/30 and about 20/20 for both eyes. In addition to this exam, we're also going to be checking visual fields and confrontation. So go ahead and cover your right eye and tell me when you see which finger you see moving.
Left.
Okay.
Right.
Okay, cover your other eye. Okay, same thing.
Left.
Okay.
Right.
Okay. Now go ahead and uncover both. Next, we're also going to check the extraocular eye movements. So go ahead and just look at my finger and follow my finger with only your eyes. Okay. And so that part of the exam tests out cranial nerves number 2, 3, 4, and 6. We're also going to be checking for the pupils and the general eye structure. So we're now looking at the eyebrows. Everything's looking pretty equal. Feeling for the lacrimal duct, any bumps to that system. And then also looking at the sclera, which is white for both eyes. And I'm going to be lifting up your eyelids to check your conjunctiva also. Okay, and while doing that, I was also looking at the iris, the pupil size, which right now would be at a 3 bilaterally. I'm also going to be checking pupil reaction to light, both indirect and consensual. So first, go ahead and look straight ahead. Oh, first let me turn off the lights here actually, so we get a better view. Okay, go ahead and look straight ahead. Okay. Okay, and then now the next eye. Go ahead and look straight ahead. Okay, so for both pupils, both direct and consensual pupil reaction was equal. Okay, now next, go ahead and look at the tip of the pen light, and I'm going to move it towards you. Okay, so pupils are both equally reactive and accommodative. And next we'll go on to the next part of the exam. For the next portion of the exam, I'm also going to be doing a fundoscopic exam to check for the optic disc, the ocular nerve or the ocular vessels, and also checking for the macula and fovea of both eyes. Okay, so for this part of the exam, go ahead and look straight ahead towards right behind my shoulder. So first, I'm going to find the red reflex with the scope. And I'll be looking at the ocular nerve, where the vessels are, and the disc. Everything looks normal, as well as no abnormalities inside the ophthalmic space. Okay. Same thing for this side. Go ahead and look over my shoulder. Looking for the red light reflex. And then checking also for the optic disc and the vessels. Okay, and everything looks normal on that exam. Okay, and the last part of the exam is I'll just be checking the cornea light reflection off of both eyes. So go ahead and just look straight ahead. And the light reflection in both eyes is the same. So let me go ahead and turn the lights back on. And next we will be examining the ears. So first I'll begin by inspecting the outer ear, just the general shape. Checking for any lumps, any changes in the tissue, any drainage, which I don't see any. Everything is normal. Next, I'll begin with the ear exam. Okay. So looking at the ear canal and the tissue color, everything is normal, pink. The tympanic membrane is normal color, pearly gray. Next for the next side. Okay, same thing for this side. Pink tissue of the ear canal and also pearly gray membrane for the tympanic membrane. At this time I'll also be testing for any hearing loss, which will be the whisper test. So go ahead and cover your left ear and repeat the 2 words back to me.
Green apple.
Okay. And now the next ear, go ahead and cover your other ear.
Blue bear.
Okay. So if there were any abnormalities to this test, then I would go ahead and use a tuning fork to test for any other hearing loss. At this time, I'll also be moving on to the nose portion of the exam. So looking at his nose, making sure it's midline, nothing's shifted. And then we're also going to test cranial nerve number 1, which is going to be for smell. So go ahead and close your eyes, and I'm going to have you smell this. Tell me what you smell.
Vanilla.
Okay, and that is vanilla, so that cranial nerve is intact. Next, I'm going to be looking inside the nose, each nostril, to check the terminates and to also just check for the general mucosa color. Go ahead and look up a little bit for me. Okay, so checking the mucosal color, everything is pink on the nose. No redness or any deviations to the septum noted. Any issues breathing? No? Okay. And then next we're going to move on to the sinuses. So I'm going to go ahead and palpate frontal sinuses. Any tenderness?
Mm-hmm.
Okay. Any tenderness?
Mm-hmm.
Okay. Okay. Any tenderness?
Mm-hmm.
Okay. And next we're going to check the mouth. So first we're going to start out with looking at the lips, any abnormal shapes, changes to skin color. Since he does have facial hair, we're also looking at the distribution of the facial hair. Everything looks fine. Just a little bit of mild dryness around the labial folds. Go ahead and open your mouth for me. Okay. Go ahead and show your teeth. Okay, so right now I'm looking just at the general color of the gums on both sides. No bleeding noted. Tissue is pink. I'm also going to be checking the mucosal color of the cheeks. Okay, so general mucosal color is pink. Go ahead and stick out your tongue. Okay, so that's testing cranial nerve number 12. Tongue is coming out midline. Okay, go ahead and put your tongue back in. And go ahead and lift up your tongue. Okay. Okay. So next, I will be palpating the inside of the mouth. Okay, so first, I'm going to check the inside of the cheeks, under the lips, above the lips. Okay. Okay, while I'm doing this, I'm also checking the teeth for any chipping, any inflammation around the gum line. Go ahead and stick out your tongue for me. I'm going to go ahead and check for the gag reflex. Okay, gag reflex is intact. That's checking cranial nerve number 10. Next, I'm going to have you go ahead and open wide and say ah.
Ah.
Okay, and that's cranial nerve number 9. I'm checking for equal movement of the, or equal rise of the uvula, which it was. Next, go ahead and open your mouth. I'm going to check the back of your mouth. Okay, so I'm looking at the hard palate and the soft palate. Go ahead and close. Checking the hard palate and the soft palate. Looking at the general mucosal color, vessels. Go ahead and open one more time. Okay, I'm also checking for the tonsils, looking for any inflammation, exudates, any kind of irritation, cobblestoning to the back of the throat, as well as inspecting the uvula. Okay, and then next we're going to, I'll be checking the last couple of cranial nerves that haven't been tested yet. So first I'll be checking facial nerve number 5, which is responsible for sensation of the face. Tell me if you feel me touching here.
Yes.
Okay, here?
Yes.
Okay, now close your eyes. And tell me if you feel me touching here.
Yes.
And here.
Yes.
Okay, you can open your eyes. Okay, go ahead and raise your eyebrows. Okay, smile. Stick out your tongue and puff your cheeks. Okay, so I'm going to be testing cranial nerve number 7. And next we're going to check cranial nerve number 11. So go ahead and move your head side to side and shrug up and down. And then put your ear to your shoulders, each one. Okay, and that's checking cranial nerve number 11, which is also intact. Cranial nerves number 8 was tested with the whisper test as well for auditory hearing. And cranial nerve number 9 was tested during the mouth examination, along with cranial nerve number 10 and 12 with sticking out the tongue, as well as testing the gag reflex. For our next portion of the exam, we are going to be doing the mental health questionnaire. And so please reply, over the last 2 weeks, have you been bothered by any of the following symptoms? Number 1, little interest or pleasure in doing things. On a scale of 0 to 3, 0 being not at all, 3 being nearly every day.
0.
Okay. Feeling down, depressed, or hopeless? Okay. Trouble falling or staying asleep or sleeping too much?
No.
Okay. Feeling tired or having little energy?
No.
Poor appetite or overeating?
No.
Feeling bad about yourself or that you're a failure or have let yourself or your family down?
No.
Trouble concentrating on things such as reading the newspaper or watching television?
No.
Okay. Moving or speaking so slowly that other people could have noticed?
No.
Or the opposite, being so fidgety or restless that you have been moving around a lot more than usual?
No.
Thoughts that you would be better off dead or hurting yourself in some way?
No.
Okay, so for this questionnaire, he did score a 0. Anything between 0 to 3 would be considered normal. Anything higher than 3 would be considered major depressive disorder. Okay, and that concludes our exam. Thank you, sir.